Good afternoon. Happy Friday. Happy Friday. Happy Friday. What do you want? What do you want? Hello. Hi, everybody. Is there anybody joining me for Fridays live on breastfeeding? Breastfeeding. Beautiful breastfeeding. Is there anybody watching? Because I don't want to talk to myself. Is anybody there? Is anybody there? Or should I just get cracking on? Should I just get cracking? Do you like my toy shop behind me? And you do know little Jeffrey there is going to be making his way to delivery suite tomorrow. And I wonder who's going to claim him. Anyway, I just really would love to know if anybody's there, because I feel like it's not working. Is anybody there? Is anybody there? Just one person, and then I know it's actually even working. Is it not working? Is it not working? Oof. Yay! One person watching. Yay! Right, we can get cracking. Right, breastfeeding. So you might be watching this on a replay. So hello, and if you've just had a baby, congratulations. You're doing amazing. Well done. You're doing amazing, because it's really hard when you've got a new baby. So we're going to there's quite a lot to cover. So I just want to make a start. But I've already put on my page this YouTube clip that I thought was really, really helpful. It looks like that, and it's got bits in like that about benefits of, hi Lauren, benefits of breastfeeding. So you've got benefits, a load of benefits for baby and a load of benefits for mothers. And, you know, thinking of my selfish self, I can't, you know, one of the best things about breastfeeding from a selfish point of view, it really burns the calories off and it pulls your stomach in. It really, it's really good for getting your tummy back in shape. Hi Liga, how are you? Good today, I hope. So, breastfeeding. So, first and foremost, breastfeeding's quite an emotive subject, because every man and his dog has a view about it. Everybody chucks their 10 pence worth in. Hi, happy Friday, it's Friday again. I'm off today, but I'm working at weekend. So I'll be busy this weekend. So anyway, breastfeeding is a really emotive subject. And number one, because there's always new research and stuff coming out about breastfeeding. And people have their own... What? You want a tasty mini, don't... Right, if I give you one of these, now then will you just leave me alone? There's only one each left. Right. So it's really an emotive subject, and at the very time when we're thinking about breastfeeding, our hormones are all over the place. We're tired, we're under pressure, and do you know what? We put ourselves under that pressure a lot of the times, and that's just what happens when you're a mum. You put yourself under pressure. You give yourself... I'm going to turn this light off because I don't need it. Do I need it? Do I need it? Stop pointing at me. You're putting me off my stride. There's none left. There's none left. It's all gone. It's all gone, look. All gone. Right. That's it. Right. I'm not being distracted by doggies anymore. So when you've just had a baby, you're full of hormones, and, you know, you're very often tired, and you want to do the right thing as a parent. Of course you do. So hopefully I'll go through some bits and pieces about breastfeeding with you that hopefully you'll find helpful. Hi, Amanda. Hi, Katie. Hi, Chloe. Liga, I'm so much better today. Oh, bless you. I'm glad you're feeling a bit better, Liga. So it's getting exciting, isn't it? So first of all, we'll start at the beginning. So you've got your baby, and I remember being there. I remember being there as a 17-year-old with this newborn baby, and what happens is everybody goes out of the room and just leaves you with this baby. I'm dribbling. Everybody goes out of the room and just leaves you with this baby, and you're like this. You're like this. Right, I've got baby Andy. This is baby Andy. We thought it was a baby Annabelle, but it's baby Andy. Pain in the backside, they are, Amanda. Right, so we've got baby Andy here, right, and you just had this baby, and it's all the elation of having your babies, all the elations, you know, just died down. You even out of lockdown, you know, the visitors go home and the midwives go off shift, and you know, the midwives obviously are always there in the hospital. I need some water. I've got some water. I feel like I'm going to get a dry throat talking too much. And then you're there and you're looking at this baby thinking, oh my goodness, how did that baby come out of me? And so you just can't stop staring at your baby. And then you think, what am I supposed to do now? It gets a little bit easier the more babies you've had, but you think, what am I supposed to do now? And it's looking at you, and then it starts crying. And then it starts crying, and then you go, I think that boob's supposed to go in that mouth, but I'm just not too sure. Not too sure about that. And it's and the baby's, if baby gets hungry, baby cries. So how are you gonna know what your baby wants when your baby doesn't speak English? How are you supposed to know? Well, there are little things that we call feeding cues, and most of the time babies, they're quite simple creatures, really. They're not easy, but they're quite simple, and they're usually, when they're brand new, they usually just cry because they're just trying to tell you something. So when they're brand new, they cry because that's their only way of communicating, and they have to cry. And if you don't get it right, they cry louder. And I did, you know, on here, I did have this on here on crying baby, so you could, oh hang on, crying baby. Oh, it's right. I'll play that to you in a minute, so you can hopefully get an idea, because while I'm talking to you, it's all nice and calm, but it's not always like that when it's the middle of the night. So when your baby starts crying, it sometimes can be a little bit overwhelming, because you're just you're there, and hopefully you've got a partner to support you to try and keep this baby alive. And it's really, really scary sometimes at first, but you don't need to be scared, because you're going to be an amazing mummy. And so what happens is your baby wants something, and it's usually just one of, they're hungry, they want the nappy changing, they just want a cuddle, or something else is wrong. And part of the problem with newborn babies is they don't speak English, and they can't tell you in English what exactly is wrong. They can't say, Mum, I am just starving. Yes, I know I had a feed 10 minutes ago, but I'm still starving. So they just cry and cry and cry and cry. So when your baby cries because your baby is hungry, it's likely that your baby has been trying to tell you it's hungry. Oh, we'll talk about baby Andy. Baby Andy, it's likely that baby Andy has been telling me for the last hour that he's hungry, because crying is quite far down the line when they're going, right, I've been sucking my hands for ages, I've been looking round. So what I did was I printed off some, we've got what we call early cues, mid cues and late cues. And I just wanted to show you some of these. So can you see on there? So we've got early cues. So these mean I'm hungry. So you've got stirring, mouth opening, and don't look at the ones below. And then we've got turning the head, seeking, rooting. So what rooting is, and a lot of people think that this is really cute when babies do that, particularly when, do you know, in the olden days when we used to have visitors, you'd get the grandparents holding the baby like this. And I've seen it when I've gone round on visits. So you've got grandparents or visitors holding the baby like this because baby's crying and they're going, oh, and they've usually got baby somewhere up here, and you can see that baby's going, and they go, I've seen it before, and they go, oh, he's kissing my neck, he's kissing my neck, all the dads, and you go, no, he's not, he's looking for a boob, he's looking for a boob. I'm just reading what you've said, Amanda. I'm not being able to breastfeed with any of my other two as my boobs get really sore at the end of pregnancy. Right, well, I can't read the rest of your comment, Amanda, but bear with me, and it might get you to just try, because I'm going to tell you about all the benefits, and it's like free weight loss. I'm having that. Right, so baby's there, rooting like this, and what they do is they're going, and they're looking for a boob. So that's what rooting is. So they're all, and they'll do things like just opening the mouth and turning the head. They always seem to put their head to the side. They know instinctively what they're looking for. So mid-cues, you've got stretching, increased physical movement, and then you've got hand to mouth. So that's what they'll do very often. They're pushing their hands in the mouth and trying to suck the hands. It does hurt, but once you've got the hang of it, you're a pro, Sally, aren't you? Right, so then we've got late cues. Late cues is the crying, agitated body movements, turning red. So these late cues, very often the late cues are what you will hear in the night, because that's what wakes you up, unless you really light sleeper and you've noticed babies doing any of these early cues. So the late cues, or the baby crying, the baby's gone, I've tried to tell you for the last hour I'm starving and you didn't listen, so now I'm going to scream, now I'm going to go rage, and you will listen to me. And it's really good because it works, because that baby knows how to get its food, and it'll cry and cry and cry, and you go, oh, it was not its nappy, and you go through your list. It's like a process of elimination. What's wrong, and it's really, really difficult because it's so hard to hear your baby crying. But midwives who sometimes help mummies out on the ward with babies, that crying goes right over their heads. It goes right over their heads. There's a chart for how many months? Platinum boobs or something? What the heck's that, Sally? There's a chart for how many months you've fed. You have to tell me more about that. Anyway, so where was I? So crying baby. So crying baby, that's what they do when they're telling you they want something. Midwives looking after babies, crying, you go, woo, because the midwives are not emotionally attached to that baby. So when the baby cries, the midwife goes, what does this baby want? It doesn't go, oh my goodness, it's awful, you're not crying again, oh my God. The midwife just says, I wonder what this baby's trying to tell me. What's this baby trying to tell me it wants? And so you just very, very quickly, the more experience you get, you very quickly go through the list of what that baby wants. That baby, right, hungry? Is baby doing any of those feeding cues? Because if baby's crying and then you're getting hold of baby and baby's starting to root, that's a really good indication that that baby's telling you he's hungry. So first of all, I think it's really, really helpful to know some of the how your breasts are actually made. So we've talked about feeding cues. We'll get rid of that one. and how your breasts are made up. So a lot of us don't really take much notice about what's inside, but I've got, right, baby Andy, can you just go there a minute? No, just be quiet and sit there a minute. Right, so this is, oh, I'll have to see where I've got me breast anatomy. I don't think I need that on. I don't think this is in the right position for me. Right, breast anatomy. So, can you see there? Struggle with breastfeeding with my first. Oh, who told me not even to bother? Oh, Alice, I'm so sorry. Oh, Alice, that's really sad. Well, I hope you find this. I hope you find this helpful. Sorry, there was a funny noise going on downstairs. I was wondering what it is. So there you go. We all kind of know what this bit is here. So we've got the nipple, and the brown bit you can see round it is the areola, the dark area around the nipple. It very often goes darker when you're pregnant and are having a baby. And then we've got the milk ducts. So that's the tube the milk travels down. And then we've got the alveoli cells, which are like bunches of grapes. And I always say that sort of lumpy structure. So all those little alveoli cells, and they're the bits that the milk comes from. And so you can see there's loads of them all around the breast, and then the yellow bits are just the fat tissue behind. But you can see it's quite a complicated structure, isn't it? And one thing that sometimes you think there's going to be one little hole at the end of your nipple, but because there's lots of these milk ducts all coming from all these different bunches of grapes, let's call them, so you get milk coming to the end out of the nipple in lots of different places. So that's sometimes when you're expressing and your milk squirts off in different directions. So that's how it's made up. And you've got some of those milk ducts there. The milk ducts, so very, very, very occasionally the milk ducts can get, so they're just little tiny tubes. Sometimes the milk ducts can get blocked, which you should always just carry on feeding your baby as normal. And very, very occasionally, if you don't get the milk duct just to start flowing again, if it's got a little bit blocked, sometimes you can get a little infection in there that's called mastitis that you probably would need antibiotics for. But in any of those problems, you can talk to the midwife looking after you about those, and she'll be able to advise you. But it's common to get, just because you get a blocked milk duct, it doesn't necessarily mean you're going to get mastitis if you can get the milk flowing again. And one way of doing that is just to carry on feeding your baby. Right, so we've done feeding cues. Right, now then, we're going to talk about different... I'm sorry, I'm getting distracted by my comments. Amanda, mine have been leaking really bad for the past couple of weeks. They never leaked... Well, do you know what that must mean, Amanda? That must mean that your boobs are saying, please, I can't wait to feed this baby. So we'll see, Amanda. See what you think after you've had a little few minutes with me, and see how you feel. See how you feel. You've not got anything to lose to just try, have you? So breast milk is amazing stuff. It is amazing stuff, right? So first of all, when you first have your baby, you produce what we call colostrum. And this is colostrum in syringes that, you can see it a bit better in those syringes, but very often new mums collect the colostrum when babies, if they're struggling immediately to get baby latched on. Some of our mums collect it in little oral syringes. The ones we have, the little purple syringes, which are oral syringes. We collect colostrum, and then with the help of the midwife just showing you, you can give that straight to the baby to make sure they're getting enough if they're not latching on straight away. And you can see it doesn't look like the sort of cow's milk that we put in our tea, does it? It's quite goldeny colour, and it's called, very often referred to as liquid gold. And that stuff, that colostrum is supposed to be there. It's supposed to be there, and there's not supposed to be loads of it. So one of the things that puts new mums off breastfeeding is because you've got a baby going mental, going mental raj, and the new mum is there. And I've got my yellow knitted boob to demonstrate so I don't squeeze my own boobs, because I can't be doing that. Right, so when you, very often, when you've just had your baby and mums will try and express a little bit of colostrum out, all you see on the end of the nipple is like a little globule of this really golden coloured stuff. So you like that and you're thinking, there isn't anything there. There isn't anything there. And what people refer to as your milk coming in is usually on this kind of round about the second, third day, when your boobs just go whoop, they're massive, and you go, oh, that's what she meant. That's what she meant, milk coming in. Excuse me. So at first, there's not supposed to be loads of milk squirting out everywhere, because this beautiful colostrum is perfectly made to line your baby's stomach. So when we have our human babies are really quite immature. The little dinky things, they can't get up and walk, they have to depend on us for everything, and all their little internal organs are all quite delicate as well. So this colostrum is ideally made just specially for your baby to just line that very immature gut. So it's just what the baby needs. It's not squeeze it, there's hardly anything there, so I haven't got any milk. That's just the way it's supposed to be, right? So that colostrum, the reason it's called liquid gold is it's got so much and so many antibodies that mums developed against things, and who knows what the benefits of mums who've had coronavirus will be. I'm sure we'll hear lots of research coming out of that in the near future. But this colostrum is amazingly brilliant for your baby. It passes on all the mums, you know, immunities and that she's made to things. So that colostrum is really, really important stuff. So if you can feed your baby, and some people do say, I'm not breastfeeding my baby, but I'll just give the baby the colostrum at first. So it lines the baby's gut. And another sort of common misconception is when your baby, very often, let me just wind back a little bit. Very often, hello, when babies are newborn, when they're first born, sometimes they just go on the breast straight away, and sometimes they'll just have a good sleep. And I think sometimes when babies are first brand new, I think they're a bit tired from being born and the birth, and they just settle. A lot of babies just settle, and you think, this is brilliant, this. I've got a really good one here. Sleeping all day. So for the first day, very often the baby will feed and then sleep for a fair period of time, because the baby's tired from being born. But then what happens, typically, is second day, second night, that baby gets a bit of taste of that sweet colostrum, and it gets a bit of the sugar and the energy from the milk, and it sort of brings their blood sugars up, and they start getting more wakeful. They start getting more wakeful and thinking, oh, I'm liking this. I'm liking this. And so typically what they do is they just want to feed at that breast continuously. Because very often on day 2, you'll say, how was your night last night? And you know what you're going to hear. How often did your baby feed? Constantly. And so the poor mum's pretty weary and tired, and that baby has been feeding at the breast. So typically those first couple of days are really, really hard for new mums because the baby just wants to feed all the time. But that baby, this baby is really, really good. So for a so I'm talking about a healthy term baby, you know, that, you know, has not got any huge problems, but is just hungry. So for a healthy term baby, they know that their one job in life is to suck at their mother's breast pretty much continuously. And the reason they do that is because their job in life is to make their mother's milk come. Because if there's no baby suckling, then the body doesn't really need to produce any milk. Like I'm an old woman. My body doesn't need to produce any milk. There's no babies going anywhere near me. You know, my breasts have done their job, you know, but for a mummy that's just had a baby, that baby goes, they're my mummy's breasts. That's where my food is. I am going to suck on those breasts until the milk comes. And it works really well. So for the mums that allow the babies to demand feed, it can be really, really quite tiring. But if you can get through those early days, it's so worth it. And I've been back to see mums again a day or two later, and the baby is suck, never stop feeding. And then the next day, the mum's milk has come in. And then what that means is that the baby the stomach fills up a lot quicker, and then the babies start going larger blocks in between feeds. So we'll talk about that. But first day or two, it's really common for babies to feed 1-2 hourly. And then it might space out to 3 or 4 hourly. But that 1 to 2 hourly going through the night is hard work. So you've just got to try and catch up on your sleep during the daytime if you've had a really busy night breastfeeding your baby. And well done you. Well done you if you manage to get through that, because it's hard. But typically what I see is when the baby has done that feed, what the mums interpret that as is, if this baby is feeding so constantly, it must be because I haven't got enough milk and I'm not satisfying my baby, which is not true most of the time. It's because that baby's going, I'm going to stay here, I'm going to suck on these breasts until the milk comes. So what that's doing is that's making sure that baby gets all that really, really, really valuable colostrum, and they're preparing their gut to get the next supply of milk. So it's usually only the second or third day that your milk supply comes in. What can happen is your breast can really fill up, become huge, and big veins on the outside. And I remember looking at mine in Marks and Spencer's changing rooms like, oh my goodness me. Don't worry, they will settle down. So what happens is your boobs almost like just massively fill up, and then they will settle down to what it is your baby's asking for, and your breasts will get used to what your baby is demanding. So, okay, so we've talked about the colostrum, liquid gold, and then, so we've got there, can you see, foremilk, and the colostrum is really quite goldy. I don't know if you'd ever get that much colostrum out. It's more likely to be tiny little bits, goldeny stuff. That's what colour it's supposed to be. There you go, foremilk. So the foremilk, I can't read that on there because it's the wrong way around. The foremilk is basically the watery drink for the baby. So it's got less fat in it, and that's why we say that you don't need to supplement your baby with extra water, because that foremilk is quite watery, and that will quench your baby's thirst. Right, however, when I had my babies, the advice was, I remember him saying, feed for so many, I can't remember what exactly it was, feed for so many minutes on this breast and feed for so many minutes on that breast. But the advice has changed, because what we know is that because the milk changes through the feed, what we want you to do is not feed for 10 minutes on this breast and feed for 10 minutes on that breast. What we want you to do is let your baby empty one full breast before you put baby onto the other side. So what that means is the baby's getting its drink, the foremilk, but then what comes is this fattier hind milk. So the fattier hind milk, that's not that amazing an illustration, but basically the foremilk looks quite watery, and the hind milk, it looks thicker, it looks creamier, it looks, I say it looks like custard, but you know, it can be thicker and creamier. And so that's in that hind milk. So if, for example, you were only ever feeding your baby for 5 minutes on one side and 5 minutes on the other side, then they're only going to get the watery foremilk. And what you want them to get is the fatty hind milk that's going to really fill them up. So sometimes I have seen in the past that if babies are only getting the watery foremilk, they tend not to be as satisfied. Newborn babies, usually one feed on one breast is usually enough. But as your baby grows, you might have to change onto the other breast, just to, if your baby's emptied one breast and then still hungry. So that's okay once your baby's growing up. Right, so I wanted to show you in just one drop. Breast milk plays an important role in a baby's development. It is both food and medicine. So one thing I want to make you aware of is advertising, okay? Advertising. So when you see your advertisements on TV for formula, they can never say this formula is as good as breast milk. They can't say, how do you know the breast is emptied? Liga, you'll be able to feel it. You'll be able to, you can feel it. Trust me. And sometimes when you come to a feed time and you're not sure which breast you're onto, you'll know because this one's nice and soft because that's the side you fed on, and this side's like massive, ready to be emptied. So you can, lots of mums will write it down because they worry that they won't remember, especially if it's in the middle of the night. And if that suits you, do that. But you'll probably be able to tell. You go, oh, fed on that side, that feels empty. Because if you can imagine your breast is all those cells, Liga, they're all full of milk. You know, it feels heavy. So you can tell, and mums can tell when. So for example, if mums have gone out for a couple of hours and they can feel that they need to feed their baby when they come back because their breasts really fill up and sometimes just feel very, very heavy. So I was talking about formula. So advertising formula on the telly, they will never say this is as good as breast milk, because it's not. So they will often say it's the next best thing, because the facts are the facts, and you're a human and you're producing milk for your baby. So it's human producing human milk for a human baby. Okay, so it's made so that it's perfectly digestible for the baby. It's got everything that the baby needs, and I'm going to show you in here what we've got, and I hope I can read through it. And formula is very often formulated from cow's milk, and I'm going to tell you a little bit about how cow's milk and human milk is made up. But cow's milk, the main difference between, and this is stating the actual obvious, the basic difference between cow's milk and human milk is that human milk is made for human babies and cow's milk is made for cow's babies. And if you look at the size of a calf and you look at the size of a baby, it tells you a lot about why that milk needs to be different. So this is human milk. So human milk in just one drop. I'm telling you this lot actually because I find it really quite fascinating how amazing the body is. So in just one drop there is water, protein, lactose, essential fatty acids, antibodies, vitamins and minerals. And then we've got hormones and growth factors, immune boosting white blood cells, good bacteria, antibacterial and antiviral enzymes. So it is really quite amazing stuff. And, oh, hang on. 4.5, what's in a drop? Right, so when we were talking about the colostrum and how much your baby needs and how often your baby feeds, so what you've got to remember, and I'll come back on to cow's milk and human milk, but what you've got to remember is the size of your baby. So our newborn babies shouldn't be going 8 hours between feeds, because they've got little tiny stomachs, and you can find various charts on the internet, and some of them, like this one I've got, says day 1 size of a cherry, and day 3 this is the size of the baby's stomach. But the one that I quite liked is day 1 baby's stomach is the size of a blueberry, a little blueberry, right, that big. So so day 1, if you think how much milk that baby can fit in his stomach, and we're talking about baby Andy-ish. Are you all right, babe? Can you see baby Andy? Right, so size of a blueberry, and you think, not going to get much milk in that. So you can't stuff a baby full of milk and make it sleep for 8 hours when it's newborn, because all that happens, if you try and stuff loads of milk in a newborn, they just sick it back up because it literally won't fit in there. So I just think this is really helpful illustration. So we've got, can you see? So day 1, stomach size of a cherry. Day 3 or to a week, size of a walnut. By about a week, size of a walnut. 1 week, size of an apricot or big walnut. 1 month, it's size of a large egg. That seems big. But anyway, you can see that what you've got to remember is the size of the baby's stomach. It does grow, they do grow. So obviously as babies, even from being brand newborn to 2 weeks old, they will increase their need for more milk because their stomachs are growing as well as the rest of their bodies. Right, now I want to talk, so we've talked about size of a baby's tummy, and that's an explanation for why your baby wants to feed 1 or 2 hourly as opposed to 7 or 8 hourly like we do, because our stomachs are a lot bigger. Right, so I wanted to go back quickly, and when I first did my breastfeeding training, I found this so interesting, and it sort of really well explains the main difference between human milk and cow's milk. So most formulas are cow's milk. Excuse me. Right, so we've got, you might have heard of whey protein, and you might have heard of casein protein. So this here is pretty much what makes up milk. So we've got there human milk as opposed to cow's milk. So you probably heard of whey. When when they're making cheese, the whey is the liquidy stuff that comes out. So we've got there, and I'm going to leave that up a little bit longer. The whey protein in human milk is, and this can fluctuate, 60% whey and 40% casein. So it's a protein that's in the milk. Cow's milk is round about 20% whey, 80% casein. Right, so what's the difference between these two proteins? Well, whey protein, when it hits acid, right, the whey protein stays in a liquid form. Are you all right, baby Andy? So the whey protein stays in a liquid form. Whereas when the casein protein hits the acid, and if you remember that acid is in our stomachs and in baby stomachs, when the casein protein in the human milk hits the stomach, or the casein in the cow's milk or formula, when it hits the stomach, the casein sort of curdles a bit more. So what happens is the whey protein is easier to digest by the baby, and the casein stays in the stomach a bit longer, and it just takes a bit longer to be emptied from the stomach. So I always saw it as like casein being a bit more to bulk the baby out, or to bulk the calf out. So if you imagine the size of a calf is a lot bigger than a human baby, and calves, when they're born, they get up and walk around. They need some filling up. So you can see the cow's milk, the casein is a big proportion of what's in that milk, the protein in that milk, and it fills the cow up. Brilliant, it fills the cow up. So that has much less of the whey protein in. So the main difference that human milk is different is it's got more of the whey protein that's easier to digest. So that's why sometimes if you've got a breastfed baby that all of a sudden is changed onto formula or cow's milk, sometimes they just struggle to poo a bit more. So human milk, the babies don't really need to try that hard to digest it. So you can see, can't you? And when they're saying that on the adverts the formula is the next best thing, because as yet they've not managed to find a way of formulating cow's milk in the same way that human milk is formulated. So you can see from that why human milk is so much easier for our babies to digest. And another thing, it's a common misconception, and so interesting looking at how the breast milk and formula is made up. What's so interesting is I've heard it a lot before that that formula babies sleep better. Formula fed babies sleep better and they sleep longer. And you can kind of see how people come to that conclusion, but it doesn't mean that the formula is maybe, oh no, I've already answered that question. So if you can imagine giving a baby a bottle of formula, you put the teat in the mouth, they don't have to try that hard, they just carry on sucking it, and it's easier to get them to have a bigger volume. Hi Danielle, hi Sarah, how are you? Happy Friday. So it's easier to get babies to take a bigger volume of formula, and because the bulking out agent or the casein there's more in that formula, it makes the baby, I always like to describe it, it's like you feel when you've had a massive Christmas dinner and you're like that, aren't you? Like that. And you've had Christmas pudding, and you've had Quality Street, and you've had crisps, and you've had nuts, and you lay on the couch and you just go to sleep. So I always think of that's a little bit when babies have had a big volume of formula. They are pretty stuffed. So we're going to come on to choices and how people feel about breastfeeding as well. But I just wanted to explain to you some of the little misconceptions. So you're right. It's near on, I think, impossible for you to overfeed a breastfed babies because they suckle until they're full, and then they just spit the nipple out. And we'll come to excuse me, we'll come to how babies sort of make it confusing for you to know if they've had enough milk or not. So now we're on to correct positioning. Hi Nicola, how are you? Look at me rosy cheeks. put the heating on and I forgot to turn it off. I'll have to turn it off before he comes home. Otherwise he'll go mad. Anyway, right. So we've talked about whey and casein. Right. So, you might have heard of people talking about nipple confusion. Have you heard that word talked about? And what they mean is when a baby suckles from a breast versus when they suckle from a teat, when you're giving a bottle, the type of sucking is different. Lots of babies manage to do both, but if you only do one and then try and change it over, sometimes babies take a little bit to get used to it. So what babies do is, if you imagine that's the teat of a bottle, what babies do is they go like this. That's how they suck on a teat. And when it's a breast, so I've got my beautiful, you'll have to excuse me doing this demonstration, and I'm really gutted that I have to now wear a mask because no one can see me doing my breastfeeding impressions. So say you've got your breast like that. What the baby has to do is not come to the breast like this. So we don't want little rosebud lips. What we want is massive wide mouth, because we want that baby to get a big mouthful of breast. So we don't want baby to go. What we want the baby to do is have a big wide mouth and be able to use it. That's the baby's jaw, and it needs to sort of milk the breast. So if we go back to, where's my picture? If we go back to this, you can see, can't you, that these are all the ducts round here. So if the baby just sucks on the end of that, it's just really not effective. It needs to have a big mouth so it can get to squeeze these bits round here. So it needs to be able to milk the breast. So that's why your baby needs a big wide mouth to properly empty the breast. So I'm going to show you some pictures of good latch and poor latch. And I loved this. I think this is from www.breastfeedo.com. And I really like that. So you've got the correct baby latch starts with wide mouth opening. So 90 degrees. You'd think that was enough, but it's not. So they're very similar, those pictures, really. But this one, you're thinking, that baby's just start again. Let's start again. So that baby's just going, I'm not opening my mouth. So sometimes when you're first breastfeeding, it does take a lot of patience, because this baby goes, do I do it like this? And you go, no, try again. And then, so when you first try and latch your baby on, sometimes it's a bit fluky. And baby opens it, narrow little mouth, and you know. So here we want, basically, so I don't worry too much about angles, but what I say to my mummies is, if you think that baby's got as much breast in his mouth as possible, great big massive wide mouth, and so this is really helpful in showing you. So we've got good and bad. So so these two pictures, so if we just look at picture A first, that's what you're going to see. So they say that the lips should be, whatever flanged means, flanged out like that, right? So that bottom lip is out. So we haven't got this going on. We want this going on. Sometimes I do this and I think no one's ever going to see me on here, and then I go, how embarrassing. Right, anyway, so you can see, can't you, that lady's nipple in picture B. Look how far back it is in that baby's mouth. So let me do a little demonstration with you. Right, I want you to now use your tongue to feel the top of your mouth. So in the top of your mouth, you've got your hard palate at the front, or pretty much what you can feel. But if you stick your tongue further back in your mouth, we've got a soft palate, and it's really quite far back. So what we want is the end of your nipple should be right the way back to that soft palate, because it's the baby's soft palate that will protect your nipple, right? And I'll show you another really, really good picture that I've found that demonstrates it. So you can see this bad latch, picture C and picture D. That nipple, that's not far enough back, baby. You're going to hurt your mum's nipple, and her nipples are going to be hanging off. That's going to feel really quite uncomfortable, and that's going to be painful. So no rosebud lips. We want great big wide open lips. And I thought this was a really good... Oh, hello. Want to see my baby? I haven't got anything for you. Right, bad baby latch in breastfeeding. Right, bad shallow baby latch. And this is from that breastfeedo.com. Right, so you can see here what we've just talked about. The red part of that baby's mouth, hard palate. The little bit right at the back, the soft palate. And then we've got the bit in the middle. This black bit here is the nipple. And then we've got the blue bit here, baby's tongue. And you can see what's going on, can't you? So nipple is shallowly inserted into baby's mouth to meet the hard palate. During suckling, nipple is squeezed between the tongue, soft tissues and the hard palate. And I'm thinking, that's hurting me already. So that's getting right clamped down. And if any of you have had babies, when a baby gets the suction just right and they suck really hard, and if you've not got your nipple far enough back in the baby's mouth, it can be really, really sore and uncomfortable, and it shouldn't be painful. So new lipstick shape. So that's how you know you've got not an ideal latch. So if you're the end of your nipple, the bottom bit's sort of just sort of flattened off like a lipstick, it's because it's getting clamped. And sometimes it's only when you start breastfeeding that you realise how sensitive that tissue is at the end of your nipple. It's really sensitive. So if your baby starts clamping down on your nipple, you'd be there going... And it can, sometimes a bad latch can cause a little bit of trauma, and then it just takes a little while to get better. So if you think your baby has got a poor latch and it's like, just release the suction with your little finger. Make sure you washed your hands, and just try again. And a lot of people, so we're going to talk about positions. But a lot of people, so what you don't want to do is you don't want to try and push your nipple into that baby's mouth, because it's going to go, and you're going to go, no. So a lot of people think, and this is just my own observations, a lot of people, what they do is they waft their nipple in front of baby's mouth, and they expect the baby to go and get a really good latch. But what happens is you get your baby there, and a lot of people say point your nipple to the baby's nose or the top lip. So what we're so you're sort of trying to point your nipple in the position that you want it to end up. So you want that nipple to end up right the way back in the baby's mouth towards that soft palate right at the back. So that baby needs a really good big mouthful of breast. So newborn babies, because they don't know what they're doing, you'll put your nose to nipple, you'll put your nipple to the baby's nose or top lip, and what they do is they just open the mouth. They don't tend to go like that and grab hold of it. They just go like that, and they just open the mouths, and they might be waggling their heads about because they're trying to root. but they very often just open their mouths. So sometimes in the very, very early days, midwives, especially on the ward or in delivery suite, will help show you little positions you can do to help latch baby on. And what a lot of them involve is when that baby opens his or her mouth, pulling them in nice and tight, so that when they open their mouth, you pull them in nice and tight and you enable them to get a great big mouthful of breast. So we're going to talk about, I'm just going to show you some positions, but explain to you the principles of positions. So that illustration's from uptodate.com. So you can see there you've got what we call cradle hold, and I'll tell you why sometimes that's not the easiest to start with. And then you've got a football position. So what they mean is like we call it rugby ball. So baby's kind of tucked under your arm and well supported. And then we've got cross cradle hold that we like to show mums first of all, because that really... What's up with dog? Stop. Do you mind not choking on my live? And then it's the old one. What is wrong with you? Got fur balls. So we've got there sideline position, which can be really helpful if you've had a cesarean section. So some really good principles to learn, right, baby Andy, are how you would like to drink a drink. Right, I've got my water here. I want a drink of water. So what we do when we're drinking a glass of water or milk or whatever, I was going to get a cup of milk to show you, but I forgot it. Right, what we do, when I drink out my bottle of water, I go like this. There you go, but you've never seen someone doing that before. So we do it without really thinking. We just get the bowl, tip it up, and go like that. So what we don't do is we don't drink our drinks in positions that sometimes we expect our babies to drink their milk in. And what we don't do is we don't hold it at the side and go like that. That's horrible. We don't do this. So you know the principle when we're having a drink, we're all in that line. We don't put our head to the side. We keep our head facing the same way. And we tip our head back. So we go, I know you're gorgeous. I know you're gorgeous. Excuse me. Right. So if you think about how we drink a drink, that's how you breastfeed. Like that. Yeah? So what we would like to see with our babies is that the baby is drinking his milk like that. Right, so he's able to tip his head back, but he's in line, yeah? So very often what they'll tell you in breastfeeding classes is tummy to mummy. So what we want is baby in this position, right? What we don't want is baby like this with his head turned that way. Does that make sense? You know this arm here? So very often that's what you get with that cradle position that we just said. Yeah, so if you get this arm and you push it out of the way, so it's down under here somewhere. Woo! Very often babies like to grab hold of their mum's boob like that, which shows that they've got a really good position. So this is cross cradle position. So I know you're probably going to have a baby much bigger than baby Andy, but I'm going to show you the cross cradle position. So you're using this arm, and it's not easy and it's a bit scary when you've just had your baby and it's your first baby and you haven't got the confidence. But ask the midwives to help show you. So what we're doing is I'm supporting baby Andy. So what I'm not doing is I'm not pushing his head onto the breast like that. I'm supporting him round here so that he can nicely just let his head tip back. So it's nice for him to drink his milk like that. Yeah, that's what we do. We like to tip our head back because this is a tube down here going down to his tummy. So I'm going to get him, and I'm going to support his head, and I'm going to support his body with one arm. And so we've got tummy to mummy, okay, got tummy to mummy. So he's in a line, he's not like that. And then what you do by having his head like that is you've got a little bit more control, and you've got this hand free. Right, what we're going to do with this hand, so you've got him controlled there, so that when he opens his mouth you can pull him in nice and tight. And then when you've pulled him in nice and tight and you think he's got a good latch, that just allows you to be able to support his head, but let him tip his head back a little bit, so that you can see he's breathing out of his nostrils, and you can see baby's got a good latch. You can see baby's got great big wide mouth. Sometimes, I'm going to just put you there a minute, baby Andy. So sometimes when you've got your big boobs that have just had a baby, especially when the milk first comes in, so you've got a big round boob with a little nipple on the end there. And by the way, it shouldn't really matter what your nipples are like. Very often women's breasts are different on both sides. Very rare do you get both nipples exactly the same, both breasts exactly the same. So it shouldn't matter what shape your nipple is, because it's called breastfeeding, not nipple feeding. So this bit here doesn't matter what shape it is. It's this big mouthful of breast that is what matters. So if you're imagining babies just go like that, and then you need to pull them in nice and tight, sometimes if that's a big round hard breast because it's full of milk, sometimes babies will struggle to get a big mouthful of breast. So the midwives in the hospital very often will show you techniques to use this free hand. So you've got your baby like that, and use this hand to try to manipulate your breast or nipple. Have I got a picture of it? Oh yeah, I have. That's hand expressing. We'll go on to that in a minute. To try and make it easier for you to latch your baby. So very often you're all hands, and it's not easy at first, but hopefully you have a midwife who'll be able to show you some little tips. So you've got a great big breast and a little baby's mouth, and sometimes that presents a bit of a challenge. Why? What? What's the matter? What? You can't have that boob. You can't have that boob. You're not having that. It's not a dog toy. Right, so what midwives will very often do, and we say, is it okay to touch? So that might be something that your midwife asks you, but obviously if you're not comfortable with them doing that, just say, no, I don't want you not touching my boobs. Right, so sometimes midwives will show women how to squidge the nipple down. So it's gone from being like that to like that, so it's in more of a ridge, just so stop it, just so the baby can get a big mouthful of breast. However, what you don't want to do is get these fingers in the way. They need to be far enough back so that it's not stopping your baby from getting a big mouthful. Does that make sense? So sometimes what we see is mums doing this with the end of their nipple, and their baby's not going to get a beautiful latch because these fingers are in the way. They're in the way, and it's only going to get that bit, and that's going to hurt. So when you manipulate your breast, and if I always say, and I'm sorry if anybody's vegetarian, you'll just have to imagine a veggie burger. But if you have a great big burger in a bun like that, and it comes to your table, and like one of them fancy ones with two meat burgers in it, and it's like that, and you're thinking, how am I going to get that in my mouth? Well, what we would do is we would squish it down, and then we can go. And it's much the same with this breast, if you imagine a real life breast. However, the thing is, when you've got your baby like this, and you've got this hand trying to manipulate your nipple into a ridge shape, what you've got to be mindful of is that this hand is in the right position, because what you don't want to do is squish your burger down like that and then trying to put it in like that. So if you're using the tip where you're just squidging your breast down a little bit so baby can get a great big mouthful, make sure that you're not doing it like that, and baby, because that's just not the right shape. It has to, the ridge has to go in the same direction of baby's mouth. Anyway, don't worry if you don't get that. Midwives will, it might become a bit clearer when the midwife shows you, but they're just little tips, because very often babies aren't amazing at breastfeeding immediately, and that's because they're a blank canvas. They haven't even, do you know what, they've been in a dark womb, they've been in a dark place for 9 months, they've never even seen light before, they've never seen a boob before. So sometimes we expect so much of them and don't give them the chance to learn. So one of the biggest tips for breastfeeding and trying to learn breastfeeding with your baby is just try and have the patience for the baby to learn, because we shouldn't get really annoyed with them just because they don't get it straight away. And I always say, babies breastfeeding, it's sometimes a little bit like training a puppy, and you do it and 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 do it. And I very often go back and visit ladies. If I go after 2 days, you can see that baby just hasn't got the hang of it yet. But if you persevere, I'll have gone back in a week and the baby, you can see that the baby's just learned a new skill. And the baby's gone, oh, right, that breast again. Oh, right, big wide mouth. Oh, right, suck. Oh, right, that's my food. So initially they're like, I'm hungry. I'm crying because I'm hungry, but I don't know what to do. I don't know what I'm supposed to be doing here. So you know, we just need to be a bit kinder to ourselves and a bit more patient with our babies as well, because we all learn at different rates as well, and some babies learn really quickly and some babies just need a little bit more practice. So try not to you know, get too wound up in it all if it doesn't go immediately. And it is really difficult when you've got a crying baby, because even when they don't know what they're doing and they go, I haven't figured it out yet, they still cry because they're still hungry. Right, okay, so baby's crying. Oh, so one of the things with breastfeeding is lots of people say to me, how do I know when my baby's had enough? How do I know when my baby's had enough? Well, typically your midwife will visit you. In this area, we visit ladies the day after they go home from hospital or the day after they've had a home birth. And then we tend to visit on day 5 to do the heel prick test. And we all also weigh babies on day 5 as well. So the reason we weigh baby is because most babies, or lots of babies, will have lost a little bit of weight. So that's normal, and we expect that to happen. And it's just because the way baby gets his or her food is just a little bit different. When they were inside, they didn't have to do anything, but now they've got to get the hang of feeding. So we expect them to lose a little bit of weight, and we hope that it's going to stay under 10% of the baby's birth weight. So the midwife weighs baby, works out what the percentage is of weight loss, and then they get a really good idea of how baby's feeding's going. So if baby's weight loss by day 5 is within normal limits, we're all really happy, and you know, we ask a few more questions about how often baby's feeding. So breastfed babies, the midwives usually will ask you, is the baby weeing and pooing? And I'll show you a chart that tells you how baby's nappy colour changes, because it's delightful. And also, you know, if they're weeing loads, then you've got to assume that something's going in the top end to be coming out the bottom end. And also, excuse me. Also, babies who have finished at the breast, and I'm going to tell you a little bit of a top tip here, because babies don't know there's rules. Babies don't know that mum's going, please will you feed for half an hour, so that oh, can you feed for 30 or 40 minutes so that you can then sleep for 3 or 4 hours. Babies go, I don't know, sorry, don't know those rules, I haven't got a rule book, don't know, I'm just going to cry when I want something. So it's really difficult to interpret what they want. A baby, typically, who has had enough breast milk, okay, so what they do is, you know, we've talked about feeding cues and rooting. That's telling you that they're hungry. And if they're rooting and showing you the feeding cues, they're hungry, whether or not they've just had a 5-10 minute feed or whether they've fed half an hour ago. If they're showing you feeding cues, it's because they're hungry. And what they tend to do when they've finished breastfeeding, so you'll have your breast right next to the mouth, right? And if babies are nice and alert and feeling hungry, they will root. So they go, and they're trying to get hold of it. So they'll do that rooting. If babies have finished feeding, typically they'll have, if they've still got a breast in their mouth, if they've got a breast in their face, there's a really lovely thing that I think that they do that shows you that pretty much they've finished, and that's they'll go. So what they do is they've got the option of having some more milk because it's there right in the face, and they've gone to sleep and they've gone like that. Honestly, it's a typical thing that babies do, like not finished, mouth clamped shut. So that's a really good indicator that they've had enough as well. So it's just a series of things that will, you know, if your baby after day 5 starts gaining weight, then that's a really good indicator. And for some babies that are not gaining as much weight as we would like, the midwife who visits you usually will come up with a bit of a plan, and it might just mean that you offer your baby the breast a little bit more often. And by the way, you can't offer a breastfed baby the breast too much. If they don't want it, they won't have it, and if they're hungry, they'll try and have it. So sometimes what I'm faced with as a community midwife is when mums try and fathom their babies out, and what they'll do is they'll say, well, I've fed my baby for 10 minutes and he just fell asleep, and so he's finished feeding. So then they interpret that as the baby's finished the feed. But because the babies don't know about this rule book that we have, right? So what they do is when they're cuddled up with their mummy and they're breastfeeding, they love it. They love it. Why would they not love it? They can smell the mum. They can feel the warmth of their mum. They can hear the mum. They're nice and warm. They're snuggled up. They just love it there. And especially if they're skin to skin. So breastfed babies, all babies love that closeness with their mummy. And even if you choose to bottle feed, babies still love that closeness and that skin to skin, because it helps with bonding and it helps with babies' brain development. So very often what happens is babies will suckle at the breast, maybe do 5-10 minutes, and because they're so chilled out and they love it there and they're cuddled, what they do is, I think they just take the edge off their hunger and they just drop off to sleep. So they drop off to sleep. Oh, so relaxed. Just took the edge off my hunger. And they just drop off to sleep. And then what the mum does is say, oh, you've spat the nipple out, so that must mean that you've finished your feed. And so what happens then is mum goes, it's finished feed, it's finished feeding. So then what they do is they put the baby in the Moses basket. Put the baby in the Moses basket. And the baby goes, and the mum goes, that baby hates that Moses basket. That baby hates that Moses basket. And then, but sometimes I think what they're doing is they're going, oh, sorry. Sorry, I've not finished feeding. I am still hungry. I just nodded off. So if that's the case, that's okay to get your baby back and put your baby back on the breast. Baby back on breast. And if your baby really has finished the feed, they won't be fussed about having it. They won't be rooting. They won't be doing all those feeding cues. They won't be trying to get it. But if you have fed your baby for a short period of time and then they just won't settle, you can just try them again. And sometimes what people do is they'll just, if your baby nods off to sleep and you think, well, 10 minutes isn't really long enough, that's not going to fill you up. That's not long enough for you. Sometimes mums will just change baby's nappy, and then they do wake up, because they usually do when you're changing the nappy, and then you can put them back on the breast again. So if you manage to get those feeds nearer to 20 minutes, half an hour, then the baby usually goes maybe 2 or 3 hours between feeds. But remember what we said about formula fed babies, and so it's really, really common, because the size of a baby's tiny little stomach, it is normal for them to feed frequently. But if you've got any issues about breastfeeding and whether you think baby's having enough or it's long enough or whatever, speak to your midwife and she can look at what baby's weight gain is, or what baby's weight gain was. But the main thing to remember is the babies don't know the rules. If they're showing you feeding cues, they're hungry. So if in doubt, put them on the breast if it's there. And when you're practicing breastfeeding, right, no time at the breast is wasted time. It's all really valuable time. If you're going to have skin to skin, get rid of them bras, get rid of them tops, have a nice loose top over the top of you. No one's going anywhere anyway, so just get yourself comfortable at home. Skin to skin, so usually you might want to put baby a nappy on so they don't pee on you. But skin to skin is so good for breastfeeding, and you can spend time with your baby, not putting yourself under pressure for breastfeeding. So you can think, well, I know my baby's not starving hungry, so what we're going to do is we're going to have some skin to skin time, and we're just going to be close, because your baby will absolutely love that. And you'll love it as well. And sometimes, even for babies that are taking ages to get the grip of breastfeeding, sometimes that bit where you're not stressed and you're just together and there's no pressure on anyone, and baby's not absolutely famished, and they'll just try, and sometimes it just happens. So having your baby next to the breast, cuddling, that there will all be things that show your baby that this is their mummy's breast, this is where their food comes from, and just get used to it, pal, because that's where your food's coming from. So it's just part of being patient with them and teaching them, because they do need to learn. And it is supposed to be a wonderful experience, and it's supposed to be lovely because you're close to your baby and you're bonding. What it's not supposed to be is it's not supposed to be fraught with anger and anguish, and so if your baby is absolutely going crazy nuts, it might just mean that baby just needs to maybe go to dad, or you just walk around with baby till they've calmed down a little bit, and and you can sing to them. All right, are we calmed down now? Should we try again? And it's just everybody being calm, because your baby recognises when you're stressed, and your baby recognises when you're nice and calm. And that's what our job as midwives are, to say, right, that didn't work for you, let's try this way, and remember, it's supposed to be a lovely experience. So one of the things that absolutely breaks my heart is when new mummies tell me, oh my God, I can hear my baby crying, and it's just filling me with dread, because the feeding's so difficult, the feeding's so painful. My personal view is that number one rule of breastfeeding is no stress. No stress, because mums put themselves under an incredible amount of stress. They have feelings of guilt, you know, and, you know, we do it to ourselves. We do it to ourselves because, you know, me as a midwife, I want you to be happy about how you're feeding your baby, you know. So we're not judgmental. We've this morning session or this afternoon session, and I've nearly been harping on for an hour and a half now, so I'm going to go in a minute. But, you know, the most important thing is that you're enjoying this experience. You've just had a baby, and what we don't want to see is your mental health going down the swanny. What we want is we need our mummies to be well, to look after their babies. So if breastfeeding is going atrociously, it's making you miserable, you know, there's always an answer. There's always an answer, and you need to be chatting to your midwife. And hopefully most midwives are not judgmental. They just want a healthy and happy mummy and baby. And however we get to that stage, you know, we're here to support you with breastfeeding. And what I never want people to do is I never want people to give up breastfeeding because they're not getting the support. So you can find via our trust website, you've probably got a little card that says FAB. That's the community breastfeeding support. You can, let me see if I can find it on here. I'll try and put a link up. Fab breastfeeding. Oh, breastfeeding. Lancashire families and babies. So you can find family and babies supporting the future of our next. There's a Lancashire help. There's a helpline on here for the Lancashire, and there's a phone number on there, a helpline, and they're available 7 days a week, 9:30 till 2:30. We are pleased to be providing this service for breastfeeding promotion and peer support in Lancashire. So I'll try and put those links on because they're such. And there's a Facebook group which is amazing. So that I just put that into Google. That's an amazing support for you, and well worth looking into, because it's hard at the moment, isn't it? It's so hard when you haven't got siblings that have had babies, or, you know, your mums and family members helping you. So the other thing I wanted to quickly show you is babies' nappies, because that's another way that we is a really handy way of telling if your baby's getting enough feeding. So can you see that? So typical infant stool. So we've got this one here. This one here, it's that dark green, black, sticky, horrible stuff. It's called meconium. That's what comes out in the first couple of days. 3 months old on the 9th. How do I? Because I've 4 the children. Oh, Leanne, have a chat with your health visitor you'll be under. Oh, Leanne, I think what you need to do is find some breastfeeding support facilities. I would definitely recommend having a look up the family and babies, the FAB. So if you just put into Google FAB breastfeeding support, have a look. And Leanne, do you know what? You're doing amazing. You're doing so well. 3 months. 3 months is amazing. You know, instead of being hard on yourself, think about, 3 months. Do you know my first baby? Do you know what? Right. How good is this going to make you? Oh, you're in the Fab group. Right, Leanne. My first daughter, I breastfed her because I was doing that breastfeeding campaign, and I thought, I better try it. I breastfed my first daughter for 2 weeks. Do you know why I give up after 2 weeks? Because I wanted to go out. I wanted to go out with a couple of friends. How bad's that? How bad is that? 2 weeks, and that's why I gave up. I'm ashamed of myself. But just reach out, Leanne, and reach out to people and just other mums that are having the same problems. My little sister, my little niece, she was born at the end of October, November, December, January, February. So she's 4 months old, and I know the struggles you ladies have, and you need to be kinder on yourself and speak to people and just say, I'm really struggling. How does everybody else manage? Right, okay, so you've got to do what you got to do. It's so difficult when you've got four older children. You're amazing. So we'll go back to those stools. So we've got meconium, we've got this is called transitional stool. So it starts to change sort of day 3 to 5. It starts changing from the black meconium. It starts changing colour. And then you've got, this is breastfed baby, so it's yellowish. It's like funny because it's sort of like mustard seeds in it. It's pretty much the colour of chicken korma. And then this one, that's a formula fed baby. It's a little bit of a darker colour, but they can both smell a bit. So then we've got concerning infant stool. So it says these are things you need to talk to somebody about. White, red, so we don't want any blood in there really. Watery, black, so that's after that initial black poo's gone. And then little pellets or fully formed. So these ones at the bottom would indicate maybe your baby's a little bit constipated, and then infant stool requiring emergency action. Bright red or black, so they need some attention. Right, so I've told you about basically manipulating your nipple to help get babies latched on, but there are some little things you can do to hand express, and sometimes hand expressing the colostrum out is really helpful to give your baby some clues as to what actually is going to come out of this if you open your mouth and you suckle. Excuse me. So I thought these were really quite nice illustrations. So you've got a widespread C hold, so your forefinger and thumb. And can you see where the bobbly bits with the milk are in? So when you hand express, a lot of people, what they do is they go like this, and they're trying to squeeze some colostrum, or they're trying to squeeze some milk out of the end of the nipple. Well, all you're doing is you're just flattening the milk ducts, because all those grapes with the milk in, they're all back here somewhere. Yeah. So where's my picture? I can't find my picture. I can't find my picture now. But you can see what I mean, don't you? So you've got those grape-like structures. They're not right at the end of the nipple. They're further back here. So, and because they're in little clumps all the way round, you can hand express, for example, there, and then that's emptied. And then you can go around and squeeze some other milk glands. So what you do when you're hand expressing, you have to go a bit further back, right? So it's not on the end of the nipple. And midwife, when you've had your baby, will be able to show you how to do this if your baby won't latch straight away, because sometimes you can squeeze a little bit of colostrum out and put it on the baby's lips, and you see it, it's lovely, and you see them going, you're going, and you can see them going, they've actually clocked on that they can taste this really sweet colostrum. So anyway, hand expressing, you're not going to be right down here. You're going to be a bit further back. And what we're not doing is we're not dragging down. So you're not doing this. You're not dragging it down like that. No dragging, right? We don't need to do that. It's not like you're squeezing icing out of an icing bag, going squeezing it down. What you're doing is you're just finding that right place, and you're just putting even pressure, and you'll see you've got it like that. Midwives usually do it a lot harder than mums do it to actually get the milk to come out. and then releasing. So you're not dragging it down like that. You do, and then you might try a different position. So you've got that C hold. So you just squeeze in, and you'll see little beads coming onto the end of the nipple. Don't let your baby knock it off with its hands, because that's really annoying. So you're just squeezing like that and then releasing. So there's loads and loads of helpful bits and pieces. I'll try and find some that are helpful, but that one that I've already put on is just really helpful first. Let me have some water and a cough. So that YouTube clip that I've already put on is just a really good all-round explaining about breastfeeding. Right, quickly onto breastfeeding pillows, right? Onto breastfeeding pillows. So you can see that this mummy here's got twins, and very often mummies with twins will feed their babies in that rugby ball position, and that looks like a really helpful pillow. One of the worst things I see with breastfeeding mums is you go around and it's fine, you can breastfeed your baby because baby's going crazy to be fed, and so you get the mum like this, and they sit on the edge of the couch and they sort of go like this, and they're getting the baby. Right, get on, right, get on. And I'm thinking, my shoulders are up here, like this, and I'm thinking, if that baby feeds for 30 or 40 minutes, that mummy is going to have a really bad back, because immediately after birth, it takes a while for all the muscles and ligaments to go back, and it's really easy to hurt your back after you've just had a baby. So number one rule of breastfeeding, the amount of times I rearrange women's houses with their pillows and get footstools out from somewhere else. I go, right, that's all right, you stay there, I'll see myself out of the house, I want you to stay there and breastfeed your baby. So number one rule, find yourself a place where your back is really nicely supported, so you feel comfortable and think, well, I'm going to be in this for a little while. So you want your back, please look after your backs. So a nice supportive cushion underneath. So we don't want any of this stooping like this because you'll hurt your back. So nicely well supported. And if you've got a couch, just remember that your arms are holding a baby, and if you're there for half an hour, 40 minutes, 50 minutes, an hour, you know, these babies are only little, but if you've been holding them for 40 minutes, they get quite heavy. So what I want to see is support for your arms so you're comfortable. So, you know, so you think, I could stay there, and actually if you sit there and you've got something that you like on telly or whatever, you know, you've got your cup of tea, and you've got to be careful with cups of tea because we don't want any hot liquids spilt. But a drink of water, because you do need to drink more if you're breastfeeding, because you need to replace that fluid. So make sure your back's nice and well supported, and these arms are well supported, because as soon as you make mum comfortable, she goes, all right, I'm all right here now. I'm happy staying here for 40 minutes. And then you've got much more chance of just everybody being a bit more relaxed. And even better, if you've got a footstool, you can elevate your feet just while you're, you know, while you're breastfeeding, and you just feel so much more comfortable. So that's a good trick as well. And I've seen some of these breastfeeding pillows. I think anything that supports your baby in the right position, where you're not leaning forward, dangling your breasts in your baby's face. Oh, I'm going, oh, bad back. You know, they're a good thing. However, word of caution, I don't want to see any of this going on, right? So those breastfeeding cushions are for you to support your baby in a good position for breastfeeding, so you're not stooping, so you're in a good position and well supported. And if that cushion brings your baby up to the right position at the breast, that's how I know I've been talking too long, that's a good thing. But this is not this is not safe sleeping advice. We don't want to, and actually that poor baby can't say, do you know what, it looks like it's like that, you know, with all this not supported. I bet that just looks like such a questionable position for your baby. So those breastfeeding pillows are not to prop your baby up. Okay. We're done now, but for all you mummies who beat yourself up daily, I've got some little quotes for you. Right, and was it Leanne? Leanne? I want you to read this out loud, Leanne. No matter if you do it for a day, a week, a month or a year, you are amazing. So if you've breastfed your baby for 3 months this far with 4 other children in lockdown, you need a medal. So have a look for breastfeeding quotes and stick something like that on your fridge just to remind you how brilliant you are. And there we go. Right. If you're a mummy who's having a meltdown day and everything's going wrong and all the kids are screaming and everything's going wrong, say this: I am not a bad mum. And it's American, but we'll change it. I am a good mum having a bad day. And that was, who was that who said that? Natalie somebody or other. Right, from wherever it is. I got that from. But I just think that's so, you're doing so well. Right, and this is the last quote that I'm going to leave you with. Hey, Mama! Has anyone told you that you're doing an awesome job? I would replace awesome with something else, but I can't think of anything. But amazing. You are doing an amazing job. In lockdown times, it is not easy. And I have finished my breastfeeding talk, but I hope you all get the support and advice that you need. But my number one piece of advice is don't be hard on yourself. Whatever you decide for your baby, it's because you're a good mummy and because you're trying to do the right thing by you and your baby. And you do matter. You matter. Your baby matters, but you matter as well. So good on you. Hope it goes all right for you, and we're all here if you need us. All right, take care. Bye for now. See ya.